massive migrant flows in a light of scale we have not seen since the Second World War.
Before we come to the statement on COVID, I would like to point out that the British Sign Language interpretation of proceedings is available to watch on Parliament Live TV. We now come to the statement. Prime Minister.
Mr. Speaker, with permission, I'll make a statement on our strategy for living with COVID. And before I begin, I know the whole House will join me in sending our best wishes to Her Majesty the Queen for a full and swift recovery. It is a reminder that this virus has not gone away. But because of the efforts we've made as a country over the past 2 years, we can now deal with it in a very different way, moving from government restrictions to personal responsibility. So we protect ourselves without losing our liberties, and maintaining our contingent capabilities so we can respond rapidly to any new variant. Mr. Speaker, the UK was the first country in the world to administer an approved vaccine and the first European nation to protect half our population with at least one dose. And having made that decision to refocus our NHS this winter on the campaign to get boosted now, we were the first major European nation to boost half our population too. And it's because of the extraordinary success of this vaccination programme that we've been able to lift our restrictions earlier than other comparable countries, opening up last summer while others remained closed, and keeping things open this winter while others shut down again, making us one of the most open economies and societies in Europe, with the fastest growth anywhere in the G7 last year. And while the pandemic is not over, we have now passed the peak of the Omicron wave, with cases falling, hospitalisations in England now fewer than 10,000 and still falling, and the link between infection and severe disease substantially weakened. Over 71% of all adults are now boosted in England, including 93% of those aged 70 and over. And together with the treatments and scientific understanding of the virus that we've built up, we now have sufficient levels of immunity to complete the transition from protecting people with government interventions to relying on vaccines and treatments as our first line of defence. As we have throughout the past 2 years, we will continue to work closely with the devolved administrations as they decide how to take forward their own plans. And today's strategy shows how we will structure our approach in England around 4 principles. First, we will remove all remaining domestic restrictions in law. From this Thursday, 24th of February, we will end the legal requirement to self-isolate following a positive test. And so we will also end self-isolation support payments, although COVID provisions for statutory sick pay can still be claimed for a further month. We will end routine contact tracing and no longer ask fully vaccinated close contacts and those under 18 to test daily for 7 days. And we will remove the legal requirement for close contacts who are not fully vaccinated to self-isolate. Until the 1st of April, we will still advise people who test positive to stay at home, but after that, we will encourage people with COVID-19 symptoms to exercise personal responsibility, just as we encourage people who may have flu to be considerate to others. Mr. Speaker, it's only because levels of immunity are so high and deaths are now, if anything, below where you would normally expect for this time of year, that we can lift these restrictions. And it's only because we know Omicron is less severe that testing for Omicron, on the colossal scale we've been doing, is much less important and much less valuable in preventing serious illness. We should be proud that the UK has established the biggest testing programme per person of any large country in the world. This came at vast cost. The test, trace and isolation budget in 2020-2021 exceeded the entire budget of the Home Office. It cost a further £15.7 billion in this financial year, and £2 billion in January alone at the height of the Omicron wave. We must now scale this back. From today, we're removing the guidance for staff and students in most education and childcare settings to undertake twice-weekly asymptomatic testing. And from the 1st of April, when winter is over and the virus will spread less easily, we will end free symptomatic and asymptomatic testing for the general public. We will continue to provide free symptomatic tests to the oldest age groups and those most vulnerable to COVID. And in line with the practice in many other countries, we're working with retailers to ensure that everyone who wants to can buy a test. From April the 1st, we will also no longer recommend the use of voluntary COVID status certification, although the NHS app will continue to allow people to indicate their vaccination status for international travel. Mr. Speaker, the government will also expire all temporary provisions of the Coronavirus Act. Of the original 40, 20 have already expired and 16 will expire on the 24th of March. And the last 4, relating to innovations in public service, will expire 6 months later after we have made those improvements permanent via other means. Second, we will continue to protect the most vulnerable with targeted vaccines and treatments. The UK government has procured enough doses of vaccine to anticipate a wide range of possible JCVI recommendations. And today we're taking further action to guard against a possible resurgence of the virus, accepting JCVI advice for a new spring booster offered to those aged 75 and older, to older care home residents and those over 12 who are immunosuppressed. The UK is also leading the way on antivirals and therapeutics, with our antivirals task force securing a supply of almost 5 million, more per head than any other country in Europe. Third, SAGE advised there is considerable uncertainty about the future path of the pandemic, and there may, of course, be significant resurgences. They are certain there will be new variants, and it is very possible they will be worse than Omicron. So we will maintain our resilience to manage and respond to these risks, including our world-leading ONS survey, which will allow us to continue tracking the virus in granular detail, with regional and age breakdowns helping us to spot surges as and where they happen, and our laboratory networks will help us understand the evolution of the virus and identify any changes in characteristics. We will prepare and maintain our capabilities to ramp up testing. We will continue to support other countries in developing their own surveillance capabilities, because a new variant can emerge anywhere. And we will meet our commitment to donate 100 million vaccine doses by June as part of our agreement at the UK's G7 summit to provide 1 billion doses to vaccinate the world over the next year. In all circumstances, our aim will be to manage and respond to future risks through more routine public health interventions, with pharmaceutical interventions as the first line of defence. Fourth, we will build on the innovation that has defined the best of our response to the pandemic. The Vaccines Task Force will continue to ensure that the UK has access to effective vaccines as they become available, already securing contracts with manufacturers trialling bivalent vaccines which would provide protection against COVID variants. The Therapeutics Task Force will continue to support 7 national priority clinical trial platforms focused on prevention, novel treatments, and treatments for long COVID. We are refreshing our biosecurity strategy to protect the UK against natural zoonosis and accidental laboratory leaks, as well as the potential for biological threats emanating from state and non-state actors. And building on the 5-point plan I set out at the UN and the agreements reached at the UK's G7 last year, we are working with our international partners on future pandemic preparedness, including through a new pandemic treaty, an effective early warning system or global pandemic radar, and a mission to make safe and effective diagnostics, therapeutics and vaccines available within the first 100 days of a future pandemic threat being identified. And we will be hosting a global pandemic preparedness summit next month. Mr. Speaker, COVID will not suddenly disappear. So those who would wait for a total end to this war before lifting the remaining regulations would be restricting the liberties of the British people for a long time to come. This government does not believe that that is right or necessary. Restrictions pose a heavy toll on our economy, our society, our mental well-being, and on the life chances of our children. And we do not need to pay that cost any longer. We have a population that is protected by the biggest vaccination programme in our history. We have the antivirals, the treatments, and the scientific understanding of this virus. And we have the capabilities to respond rapidly to any resurgence or new variant. And, Mr. Speaker, it is time that we got our confidence back. We don't need laws to compel people to be considerate to others. We can rely on that sense of responsibility towards one another, providing practical advice in the knowledge that people will follow it to avoid infecting loved ones and others. So let us learn to live with this virus and continue protecting ourselves and others without restricting our freedoms. And in that spirit, Mr. Speaker, I commend this statement to the House.
Can I just... Mr. Sherman, please. Can I just say, I understand the statement was important and the Prime Minister did run over, so I'm more than happy for the opposition leaders to also run over. Keir Starmer.
Yeah. Thank you, Mr. Speaker. Can I start by sending my condolences to the family of Christopher Stalford? Christopher was a dedicated servant of the people of South Belfast, and his loss will be deeply felt. I'd also like to send our best wishes to Her Majesty the Queen, and as the Prime Minister said, the whole House wishes her a speedy recovery. Yeah. Can I thank the Prime Minister for an advance copy of his statement and for the briefing earlier this afternoon. Mr. Speaker, huge efforts have been made over the last 2 years, and we would not be where we are today without the heroism of our NHS and key workers, those who pioneered and rolled out the vaccines, and the sacrifices that people made every day to follow the rules and protect our public health. Yeah. We must honour the collective sacrifices of the British people and do everything possible to prevent a return to the loss and lockdowns we've seen over the last 2 years. Yeah. The Prime Minister promised to present a plan for living with COVID. But all we've got today is yet more chaos and disarray. Not enough to prepare us for the new variants which may yet develop. An approach which seems to think that living with COVID means simply ignoring it. This morning he couldn't even persuade his own health secretary to agree the plan. So what confidence can the public have that this is the right approach? Mr. Speaker, let me be clear. The Labour Party does not want to see restrictions in place for a moment longer than necessary. But, Mr. Speaker, we have to take the public with us, and that requires clarity.
Order. If you can't show the respect that I expect the Prime Minister to be heard inside, I expect the Leader of the Opposition. If you don't wish to be in here, there's plenty of room outside this chamber. I suggest you start using it, and I'll be helping you on your way. So let's have silence. Keir Starmer.
Mr. Speaker, we have to take the public with us, and that requires clarity about why decisions are being made. So will the Prime Minister publish the scientific evidence behind his decision to remove the legal requirement to self-isolate, including the impact on the clinically extremely vulnerable, for whom lockdown has never ended? Having come this far, I know the British people will continue to act responsibly, and they will do the right thing, testing and then isolating if positive. What I can't understand is why the Prime Minister is taking away the tools that will help them to do that. Free tests can't continue forever, but if you're 2-1 up with 10 minutes to go, you don't sub off one of your best defenders. The Prime Minister is also removing self-isolation support payments that allow many people to isolate and weakening sick pay. These are decisions which will hit the lowest paid and the most insecure workers the hardest, including care workers who got us through the toughest parts of the pandemic. It's all very well advising workers to self-isolate, but that won't work unless all workers have the security of knowing that they can afford to do so. The Prime Minister mentioned surveillance and the ONS infection survey. This is crucial to ensuring that we can ramp up testing and vaccination if the virus returns. So can the Prime Minister confirm that he has put the funding in place to ensure that the ONS infection survey will not see reduced capacity and that it will be able to track the virus with the same degree of detail as it can today? We can't turn off Britain's radar before the war is won. Ignorance is bliss is not a responsible approach to a deadly virus. It actually risks undoing all the hard-won progress the British people have achieved over the last 2 years. Mr. Speaker, the Labour Party has published a comprehensive plan for living well with COVID. Our plan would see us learn the lessons of the past 2 years and prepared for new variants. His approach will leave us vulnerable. Where's the plan to secure the UK's supply of testing? Why are schools still not properly ventilated? As a nation, there is no doubt we need to move on from COVID. People need to know their liberties are returning and returning for good. But this is a half-baked announcement from a government paralysed by chaos and incompetence. It is not a plan to live well with COVID. Thank you.
Mr. Speaker, I really thought this was going to be the moment when he would end his run of making the wrong call on every single one of the big decisions. But, Mr. Speaker, time and time again, he's had the chance to back the government on the big decisions, and I'm afraid that he's got it wrong. And just turning to some of the points that he's made, the evidence for what we're doing today is amply there in the scientific evidence, in the figures for the rates of infections that I've outlined today, and in all the data that is freely available to members of the House. And they can see what's happening with infection rates, with mortality, with what Omicron is doing across the country, Mr. Speaker. He asks about the clinically extremely vulnerable, and that's, of course, an entirely reasonable question. But what we are going to do is make sure that they continue to be protected with priority access to therapeutics and, of course, to vaccines as well. He asks about testing, Mr. Speaker, which is absolutely satirical, because week after week, month after month, I've listened to the Labour Party, Mr. Speaker, complaining about NHS testing, denouncing the cost. Did you not hear them, Mr. Speaker? Denouncing the cost of NHS test and trace, and now they want to continue with it when, Mr. Speaker, we do not need to go on with it in the way that we are currently doing. So he asks about our ability to do tests, or our domestic ability to manufacture tests. It's as though he doesn't know, Mr. Speaker, that we have in this country now one of the biggest manufacturers of lateral flow tests in Europe. Mr. Speaker, this is a leader of the opposition who, as I say, has shown an absolutely ferocious grip of the wrong end of the stick. He never ceases to amaze. He was wrong on July the 19th. If you remember, totally wrong. He said we shouldn't open up on July the 19th. He said that the Labour Party, there he has said that we needed a roadmap back into lockdown, Mr. Speaker, during December. They wanted to stay. He voted several times. They wanted to stay in the European Medicines Agency, Contrary to his denials in this House, Mr. Speaker, he voted several times to do so. He's been consistently wrong on all the big calls. He was wrong then, he's wrong now. What we are doing, Mr. Speaker, is moving forward in a balanced, sensible and proportionate way. Moving forward away from legal compulsion in a way that I think the British people understand, and trusting in them and trusting in their great sense of personal responsibility.
Thank you, Mr. Speaker. I support today's announcement, which is a tribute to British science and to the government's leadership in the vaccine programme. Does the Prime Minister agree, when it comes to future pandemics, that the real danger zone are those early months when we don't have a vaccine against a new virus? And in that context, it's not just whether the NHS can cope, but whether the NHS can cope without switching off other vital life-saving treatments. And if he agrees with that it is not just enough to say that we have more doctors and nurses than we had before, but that we also need to make sure we have enough doctors for the future. And if he has plans for that, would he please tell the House how he will make sure that we are actually training enough?
I thank my right honourable friend very much. And he's returning to a theme. He's returning to a theme that he's mentioned several times. We have a vast plan, Mr. Speaker, to recruit more nurses and more doctors than ever before. There already are more in the NHS than at any time in our history. We have 45,000 more now this year healthcare professionals than there were last year, Mr. Speaker, and we will continue to fund them.
Leader of the SNP, Ian Blackford.
Thank you, Mr. Speaker. This statement was billed as a Prime Minister's moment of pride. But it's clear that this morning has been a moment of panic for this government. Disagreement across Whitehall and a lack of any serious engagement with the devolved nations shows that these decisions are bereft of science or consultation. It appears these dangerous choices are purely political and have been made up on the hoof. It is another symptom of a government in turmoil. The illogical reality of UK finance means that these decisions, made for England by a failing Prime Minister, affect the money the devolved nations have to provide testing. It is unacceptable that the ability to protect money, I hear money. We're talking about protecting the people of Scotland, something that this Prime Minister is turning his back on. And it's unacceptable that the ability to protect our population can be imperilled on the basis of a political decision taken by a Prime Minister in crisis. His decisions directly affect whether Scotland has the funding required to keep its people safe. That is the ridiculous reality of devolution, but it's a reality that must be addressed. So will the Prime Minister now confirm what the residual funding for testing will be to enable the Scottish Government to pick up the pieces of this chaotic withdrawal of support? Mr. Speaker, it makes the case for Scotland to take necessary measures to keep our people safe. We need the financial ability to make our own choices. That, Mr. Speaker, only comes with independence. Mr. Speaker.
I will also hear the Leader of the Opposition in silence. I don't need the Burger King. He certainly doesn't need it. I don't need it. In Blackford.
Thank you, Mr. Speaker. PCR testing, the legal requirement to self-isolate and access to lateral flow testing have been instrumental, Prime Minister, in containing the virus. As we move forward to live with COVID, these are the very safeguards which support a return to normal life. And these short-sighted decisions have long-term implications. They also hamper vital surveillance efforts and impede the ability to respond to new variants. Mr. Speaker, the reality is that we have a Prime Minister beset by chaos and mired in a police investigation for breaking his own COVID laws, and he can shake his head, but that's the reality, Mr. Speaker. A Prime Minister who has no moral authority to lead, desperately seeking to appease his backbenchers. We know this reckless statement flies in the face of advice from scientists at the World Health Organization. That's because this statement is not about protecting the public. It's about the Prime Minister scrambling to save his own skin.
Well, Mr. Speaker, you wouldn't believe it from what the right honourable gentleman has just said, but the cooperation between the UK government, the Scottish Authority, has been outstanding and will continue to be outstanding. And I can tell him. He asked about free tests and how they're to be paid for. It's very important. The free tests will, of course, continue until the beginning of April. And of course, if people want to continue beyond then, and I've set out for the House the reasons why we think it's much more sensible to focus, Mr. Speaker, on surveillance and spotting new variants, put our investment into that rather than mass testing. Then he has, Mr. Speaker, access to the 41 billion record settlement that he has under Barnett, and he also, Mr. Speaker, has access to hundreds of millions from the health and care levy. The only astonishing thing is that he voted against it.
Thank you, Mr. Speaker. I warmly welcome the statement that the Prime Minister has made. The Prime Minister will also be aware of growing international evidence that lockdowns have been largely ineffective in preventing COVID mortality. And we're acutely aware of the massive damage which has been done economically and to non-COVID health of the people due to lockdowns. Will he review pandemic planning for the future to make sure these crucial lessons are learned?
Yes, I thank my right honourable friend, and he's right to draw attention to all sorts of studies about the efficacy of lockdowns. We'll look at all the evidence. I happen to think that the collective actions of the British public were indispensable in saving many thousands of lives, Mr. Speaker, but I'm sure that all the evidence will be looked at in the course of the inquiry.
Hilary Benn.
Thank you very much indeed, Mr. Speaker. New antiviral drugs have made a huge difference to the treatment of COVID. They are indeed, as the Prime Minister says, the first line of defence, but they work best when given early. Now, one of the requirements at the moment in order to qualify to get an antiviral drug is that the person has tested positive for COVID. If the Prime Minister is going to get rid of free lateral flow tests, how are people going to get access to those medicines?